Hello, we are Parkland College dental hygiene students. We are going to be discussing the link between oral hygiene care in intubated patients and its association with ventilator-associated pneumonia. Our objectives for this video include clearly state the link between the oral cavity and ventilator-associated pneumonia, assessment of the oral cavity, comprehensive oral care protocol. According to the U.S. National Library of Medicine National Institutes of Health, ventilator-associated pneumonia is an infection in the lungs that a patient can acquire while being intubated. While a patient is intubated, oral care can be hard to perform successfully. The teeth will begin to retain plaque consisting gram-negative and gram-positive bacteria. With this being said, these need to be removed. When the oral care is not adequately provided, bacteria that is not suctioned can travel down the esophagus and be aspirated into the lower respiratory tract. Listed here are the microorganisms associated with VAPP, as well as the microorganisms that can be found in the oral cavity. As you can see, the S. aureus and K. pneumoniae are found in both VAPP and the oral cavity, creating the correlation and the need for successful oral care. It has been found that 25% of all critically ill patients are affected by VAPP, and it is developed within 48 to 72 hours of intubation. Once diagnosed, the patient's stay is extended 4 to 9 days beyond what it would have been. With the extended stay, costs begin to rise, equaling on average $40,000. As well as cost, the mortality rate is 50% for patients diagnosed with VAPP. Good oral care is important in patients who are hospitalized, especially when it comes to ventilator-associated pneumonia. In patients who have ventilator-associated pneumonia, it often occurs because of the inhalation of pathogenic bacteria that form in the mouth. Within 48 hours of hospitalization, the normal bacteria in the mouth of these patients is converted to pathogenic bacteria. By giving consistent oral care to these patients, this will help decrease the likeliness of inhalation of pathogenic bacteria into the lungs. Also, it will help stimulate saliva flow, which is our natural barrier against bacteria. This is a bedside oral assessment chart and is used at many hospitals. As you can see in stage 1, everything is normal in the oral assessment. The lips are smooth and pink, while the tongue is wet and pink. The saliva is watery and the mucous membranes are pink, firm, and moist. The teeth are also clean, or there are not any. Stage 2 is defined as having pain or difficulty swallowing. It is classified as moderate dysfunction and is characterized by dry or cracked lips, coating or loss of papillae, thick or ropey saliva, and red or coated mucous membranes with no ulcers, edema with or without bleeding or redness, and debris between the teeth. This all results with slight to moderately foul breath. The final stage is stage 3 and is described as severe dysfunction. This occurs when there is no ability to swallow, lips are ulcerated or bleeding, the tongue is blistered, cracked, or bleeding, saliva is absent, mucosal membranes are ulcerated with or without bleeding, gingiva bleeds easily, there is a general amount of debris and decay is present, and the breath has a strong foul odor.
I am going to walk you through the oral care protocol. When doing oral hygiene care on an intubated patient, you will want to position them in a semi-supine position. You will then use the bedside oral assessment we talked about previously. You will then want to use the BASS technique to brush the teeth. The BASS method consists of using a soft bristle brush. You will also want to make sure that you're using gentle pressure when brushing. When brushing an intubated patient, you will want to dip the brush in a chlorhexidine or an antimicrobial rinse. You will then start on either side of the mouth, brushing a few teeth at a time, and work your way to the other side. Hold the toothbrush at a 45-degree angle towards the gum line. Move the toothbrush in small circular motions at the gum line. After doing a few vibrating motions, do a sweeping motion away from the gum line. This will help remove the plaque and bacteria out of your gums. In the front, at the top and bottom, you want to make sure that your toothbrush is held vertically and do gentle strokes up and down. Next, you want to clean the biting surfaces of your teeth doing a back and forth motion. Now I will demonstrate the BASS technique on a patient. It is important that the oral cavity is rinsed with an antimicrobial. Since the patients are intubated, dipping the toothbrush into the antimicrobial would be effective when using this in conjunction with the BASS technique discussed earlier. Patients that are intubated should receive this daily care. Brushing with the antimicrobial will help to prevent the incidence of specific bacteria in dental plaque that can cause VAPP. According to the Department of Cardiac Surgery, the present study showed that chlorhexidine gluconate effectively diminished the bacterial load of dental plaque, reducing its pathogenic potential, and oral decontamination effectively decreased the incidence of VAPP in patients hospitalized in ICUs. Chlorhexidine is a great antimicrobial rinse. If there are no contraindications and chlorhexidine is prescribed, then directions should be followed per the prescription label. To clean the intubated tube, you can soak a gauze square in chlorhexidine and wipe off the tube.
Thank you for listening, and we hope you have a better understanding of oral hygiene and its association with VAPP.